India is the largest and most populated country of Southeast Asia and a host to the maximum number of patients with diabetes, which is expected to rise from 67 million to 101 million. Diabetes, as we all know it, has many complications, and one of them being diabetic retinopathy. Now, this diabetic retinopathy is a long-term microvascular complication, and also it is studied that it is an important predictor of diabetic nephropathy. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the vascular complications in the eye that is caused by diabetes mellitus. Diabetes-induced retinopathy mostly precedes nephropathy in patients with type 1 diabetes. However, this particular sequence is not consistent in patients with type 2 diabetes and has significant discordance. An observational cross-sectional study published in the Journal of the Associations of Physicians of India found a relationship between retinopathy and nephropathy in type 2 diabetic patients. It was seen that patients with type 2 diabetes did not have diabetic nephropathy always. It was a hospital-based prospective study that was conducted at the Indira Gandhi Medical College, Shimla. 141 patients with type 2 diabetes, that is 83 males and 58 females, were recruited in the study. The mean HbA1c of the study was 9. It was found that 56% of the patients in the study had the HbA1c levels more than 9%, while 27.7% had this value between 7 to 9, and only 16.3% of these patients had this level less than 7. Out of the total of 141 patients, diabetic kidney disease was present in 47.5% patients, and 33 had diabetic retinopathy. Hence, it was recorded that the relationship between retinopathy and nephropathy in type 2 diabetes patients is not as clear as in case of type 1 diabetes, and patients with type 2 diabetes conditions do not have diabetic nephropathy always, and non-diabetic renal disease is also quite common. The absence of retinopathy, rapid progression diabetes, the presence of RBCs are some of the atypical findings, and patients presenting with them should be subjected to renal biopsy to rule out any non-diabetic renal disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.